Indiana's maternal and infant mortality rate has exceeded the national average since at least the 1990s. For every 1,000 births in 2022, 7 infants died before their first birthday, putting Indiana at the 7th highest position for infant mortality in the nation. Rural Hoosiers and Hoosiers of color, in particular, experience inadequate maternal and infant health care due to a lack of physicians, hospitals, and specialty services. How can we improve Indiana's maternal and infant health outcomes while also reducing racial and geographic disparities?
So we have to have a great healthcare system, and we are fortunate to have some of that in place. The expense of it and the access is a huge concern because we've developed, and this is no secret, a monopoly in our healthcare system. So the competitive, more rural areas, clinic type of feelings, those have all closed down. Many of them have. In some of our rural areas are areas where our brown and a lot of brown and black Hoosiers live. And so in some of those communities, they don't have access to quality care. 1/3 of our counties do not have an OBGYN, and that plays right into those statistics that you just shared and is a direct feeder into that problem. We also must embrace aggressive programs and education to help families plan and help get the resources they want to prevent unwanted pregnancies or to assist if you're with family planning. And so there's a whole lot of layers to that, but as a state, we also have to quit beating up our physicians and putting them in really horrible situations where they're not sure what they can practice and what they can't practice, and are there going to be legal ramifications, and it really does not incentivize the most talented to come to Indiana or to stay in Indiana, so we're feeling that. We certainly have a shortage in that space across the board, but that goes back to we need to have the most talented individuals stay in Indiana, and we want them to work here and be part of our communities. The other piece of that for our infants is we have 25% of our counties that do not have pediatricians. And the scary part of that is when I go into communities, sometimes I hear like, what's a pediatrician or what is an OBGYN? And if you don't know what those are, you've never been to those or you've never had the opportunity to take advantage of those. So it's access, it's making sure that it's affordable, it's making sure that we have the transportation in place to get people where they need to go for that health care, and making sure they're educated on what is out there and what's available and how do we get it to Hoosiers. It is a huge problem at a time where we're one of the 3rd highest cost in health care, and how do we get those costs down but also increase access for all Hoosiers?
That is a shameful statistic, and especially when you juxtapose it to having some of the highest healthcare costs in the country. Probably the proudest thing I've done in business or politics would be taking on cost of healthcare back in '08. We did that before the law required you to cover pre-existing conditions. I was sick and tired of hearing how lucky our business was. It's only going up 5 to 10%. When healthcare costs that much, it's going to be less available to everyone. Everyone deserves it, regardless of ethnicity, station in life. I think the other side of the aisle owns that issue. We were flat-footed when we didn't have any alternative to the Affordable Care Act, Obamacare. We were defending a broken system. I intend to take that on as our next governor, and if you get it right, where it's based upon prevention, remediation, generally getting better ways that we actually run our own lives to keep ourselves healthy, and then not demand expensive, immediate remediation, you'll actually get at the roots of things like infant and maternal mortality. So it generally doesn't get addressed at the state level because one part of the spectrum wants the federal government to do it all. That's not a solution when we're going broke there. Our side thinks there's nothing wrong, and I know it can be improved. So that's taking on the biggest industry in our state. It's approaching now 20% of our GDP. Back when I wrestled with it, it was closer to probably 10. So something's got to give. And if we're a state, again, that you want your own kids to move back to, you can't have a statistic like that. I was glad to see that in the last session, we took a step towards acknowledging it. Then we got to be entrepreneurial because it's in a context of a really expensive, clumsy delivery system, and I need to get big health care to come the way of making that more doable?
Well, this is an issue that was a question that was asked 4 years ago. And so the first thing that we have to realize is, here again, our state government doesn't seem to be addressing this issue. And one of the reasons that I think that is because healthcare is a complex issue. Part of the problem that we have, and I'm going to go back to our professional licensing, we have a shortage of midwives in Indiana, and we need more midwives because in many of these areas, whether it be an urban area or a rural area, our large corporate healthcare facilities and organizations, for whatever reason, don't deem it profitable to provide health care in these areas. You unfortunately find that doctors cluster together now, many times because health insurance costs and the overhead involved in a provider dealing with the insurance company makes it difficult for them to be independent. They have to kind of network together in order to split the cost of the overhead involved. And so I think there are a couple of things that we need to do right away. One is get nurse practitioners, midwives, make it easier to get into that field. Here again, a lot of that is education. Post-secondary education is way too expensive. We need to figure out how to make the educational opportunities more affordable for people. That's a complex issue that we can't solve sitting right here, unfortunately. But there are things that we can do. The professional licensing, making it easier to maintain a professional license in the areas of healthcare, making it easier for what I will refer to as the old country doctor, right? The doctor who would actually come to you. We don't have that today. We've got to figure out how to make it financially viable for healthcare professionals to be able to provide the type of services. I think we're starting to see that with direct primary care. I think if you look at being able to go to a Kroger or a Walmart to get care from a clinic, but here again, in a lot of the areas we're talking about, there are no Krogers, right? Because your healthcare desert is also a food desert. And there's an issue there, and we've got to figure out, and here again, it's not, we can't just keep taxing people over and over and over, more and more and more, and then saying we're going to take this money and give it to somebody to go do this, because that won't work. That's not sustainable. But we've got to start addressing these problems where they are. And the reality is we don't have enough people who are able to provide health care in an affordable way to these particular groups of people, whether they be urban or rural. And we've got to get together and focus on how to do that and stop focusing on how we create regulations that increase the monopolies of the large healthcare corporations we have today. And there's nothing wrong with the large healthcare corporations we have today, but we also have to have, if you will, the mom and pop, the small business, the entrepreneurial healthcare provider that can afford to meet the regulatory burdens and be able to provide what people need.